So if we move on to the next item here, the health risk assessment. This is how I've made most of my careers, doing health risk assessments and dispersion analysis and exposure assessments. The important value in all of this is finding out what the true source terms are. What can we reliably say is the amount that's coming out? So you start with a baseline. What can be produced from this facility? And then after that, you add on assessments that say, well, if the control technologies are working well, this is what we kind of expect. And again, control technologies work for a period of time until the maintenance doesn't work. So my experience over the last 20 years is when they initially go in, they're great, but it's that very important part where people coming back in and taking control of this and making sure that they're constantly working, which is vital to the whole consideration. You define your source term, and then you go ahead and create a dispersion model. You take the chemicals and you move them from your site and you see where they go. Chemicals don't go in a straight line. Winds shift. They will move all over the place. Some days the predominant wind pattern may be over the park. Some days it'll reverse and it'll go back up towards that new housing developments that is there. So these are things that have to be considered along the way. There's a worst case that has to be evaluated, and there has to be an averaging that goes on. When we take this together, we create a dose. What is the average dose that we expect an individual to be exposed to? And a very important consideration has happened over the last couple of years. EPA and AEHA and the state of California have determined that children don't react the same way as adults do when exposed to toxins. So now, in their air toxins program, they want us to consider modifying factors that actually cause the the cancer slope factor, what we determine the risk from, to be elevated for children. So any type of assessment that is done on this plant must incorporate this kind of idea. Otherwise, it's not being health protective. And you have to make some kind of simplifying assumptions along the way. If you want to compare one risk to the other, the standard model is to say somebody has been exposed for a lifetime, which is essentially 70 years to this. This is the metric that we use. This is the only way that we can say this is a really good site, this is a really bad site, and for the really bad sites, these are the steps that you need to take to make it a better site, to reduce what's coming out along the way. If we move on here, odors. I think I'm starting to run past my time, but let me go through the odors very quickly. Odors are not just a nuisance. Odors cause physiological changes. There's a response which occurs. Some people are so sensitive to odors that they will have negative permanent consequences to that. I had a partner of mine who was working a case in Rhode Island. Woman lived adjacent to a landfill, and the odors overwhelmed her so much that with her asthmatic condition, she went into asthmatica statica and died. So the odors ultimately led to an adverse reaction which led to her death. Let's skip through all the odor. Keep going there. Keep going, keep going. Stop right here. There's one item with the odors that I really do want to discuss more in detail. Part of the evaluation that must occur for this site is what are the potential impacts related to odor. That's one of the things that people will pick up very quickly. For this type of plant, Bay Area Air Quality Management District suggests that a survey, or that the area of influence is 2 miles. 2 miles from the stack or from the boundary of the facility out to where we're going on. So similar properties or similar projects which have a 2-mile boundary are rendering plants, are landfills, are waste treatment plants, wastewater treatment plants, things that produce, and petroleum refineries, things that produce significant quantities of chemicals which can be detected by humans. So if we flip to the next screen here, this is my estimate of what a 2-mile radius around the facility would look like. Someone described it as Pac-Man. I think it kind of, I was bending it based on an early version of what the facility looked like. But with a 2-mile radius, we're now covering the new KB homes and linear homes that are there. You cover the park, and it extends out to where the Montessori school is. So now we've identified specific sensitive receptors that a further evaluation needs to be performed. What would the likely concentrations be along the way? If this odor survey is done after the fact, the horse is already out of the barn. You know, you're locking the barn door and there's nothing you can do about it at that point. Maybe you can put some very expensive technology on top to control what's going on there. It's better to fix the issue before it goes in. If we go to the last slide, I'd like to talk about the threshold values. If we go to this last slide here, one more. Threshold levels in psychoanalysis and guidance levels that are derived, whether it's a PM10 value, a PM2.5 value, benzene levels or whatever, are meant to be health protective. They're a starting point for what's going on. It's the regulatory agency's best idea of where we should be starting. The problem with that is that we all know that there's large variability with populations, and the doctors can attest to the fact that they've seen patients with different thresholds of pain or functionality or whatever may go on there. So take those levels with a grain of salt. Don't think of them as a basement. Well, this is where we can start out here. Think of them as the ceiling. If you're exceeding that value, the regulatory agencies are saying you're going to cause problems down the line. So if you're pumping out massive amounts of NOx, you're going to have issues in this community. And that NOx doesn't stay there. It gets transported along the way. The same with particles. They will get transported along the way. The same with PM10 and PM2.5. And as we've gone through this process with regulators, I have never seen a standard go up. I've never seen them say it's okay to put more pollution out. And in fact, I've only seen them ratcheting down further and further. So our concern initially had been particulate matter, and then we defined PM10, and now we're defining PM2.5. And the next level is going to be, what are the ultrafine particles coming out? What are those particles that are going to go all the way into the cells going to do to the individuals in this community? So I would advise you to cautiously evaluate what's going on before anything else happens.